Could you imagine taking a bite into a warm, gooey chocolate brownie and having your nausea disappear? Or maybe even popping in a hard piece of candy into your mouth and gaining your appetite back? In the past, medical marijuana has been seen as a horrific drug, but in today's society, it is now valued as medicine. As someone who wants to be a pharmacist, I believe it's vital that both I and the public are aware of the new prescription drugs out there today. To give you a better understanding, I'm going to first talk about how it affects the brain. Then I'm going to continue on and explain the main reasons for its use. And finally, I will talk about the different methods to use medical marijuana. Medical marijuana is the common name for the plant genus cannabis. The main ingredient in this plant is delta-9-tetrahydrocannabinol, also known as THC. The T comes from the T in tetra, the H comes from the H in hydro, and the C comes from the C in cannabinol. John Erickson explained in his article, found in Medicine Daily, that when you smoke THC, it passes from the lungs into the bloodstream and then continues on to target CB1 receptors found in the brain. The side effects of using cannabis is reddening of the eyes, dry mouth, sensation of the skin, and muscle relaxation. CB1 receptors also influence memory, sensory, pleasure, and thoughts. By targeting these senses, we can help alleviate pain. In fact, medical marijuana has a beneficial use to relieve many different types of pain. Clark, Ware, and Yazzer conducted a study in 2005 that medical marijuana on patients with multiple sclerosis is a positive thing. The treatment was effective for improving stress, pain, and spasms, while also helping sleep and mood. Another study in the Journal of Pain and Symptom Management, HIV patients used medical marijuana to treat their symptoms. 86 to 97% showed improvement for appetite, muscle pain, nausea, anxiety, and depression. The THC in cannabis also relieves nausea and vomiting for chemotherapy patients for cancer. In the New England Journal of Medicine, 15 out of 20 people under the age of 20 years old responded positively to the THC medicine. Other common reasons for using this medicine is chronic pain, hypertension, arthritis, osteoporosis, diabetes, and Alzheimer's. Now that I have told you how medical marijuana affects the brain and why it is used, I will explain the different ways you can use this medicine. The first way you can use medical marijuana is by smoking the leaves, which creates an immediate effect. By using pipes or papers, you can compress the leaves into a small area to smoke. A newer, more popular way is through a vaporizer. This middle picture here is a large vaporizer that can be used at home while in the comfort of your own bed. With today's advanced technology, we could also use more portable versions like this vaporizer. Nalanka's article, Ways to Consume Medical Marijuana, explains that when the device heats up, it's done at a low temperature and produces fewer byproducts like smoke. Another way you can use medical marijuana is by eating it. By cooking it into oil or butter, you then cook it into food. These are commonly known as edibles. Although these edibles take a longer time to work, they are a much healthier substitute to smoking and last a lot longer than any other consumption methods. The common edibles include gummy bears, candies, lollipops, brownies, and cookies. To sum up, medical marijuana is seen today as a beneficial drug. By understanding how it affects the brain, reasons for its use, and how to use it, we can responsibly and effectively use this new medicine to help those in need. Thank you.